For thousands of years, Libya has served as the gateway to Africa. The Phoenicians were the first to establish trading posts in Libya, followed by the Greeks and the Romans. These ancient civilizations left behind a legacy of legendary prosperity and culture still visible at the World Heritage Site of Leptis Magna near Tripoli. Today, Libya is a country of 6 million people in transition. On February 17, 2011, the Arab Spring ignited a revolution that ended the 43-year reign of the brutal dictator Muammar Gaddafi. After the Civil War, the country has been fraught with internal conflict. The political unrest culminated in the attack of the U.S. Embassy in Benghazi on September 11, 2012, where U.S. Ambassador Chris Stevens was killed. The night Chris Stevens died, Dr. Thomas Burke, Chief of Global Health and Human Rights at Massachusetts General Hospital, was in Benghazi, helping Libyan physicians improve emergency health care. The story that follows from that fateful tragedy is one of forgiveness, compassion, and partnership between U.S. and Libyan doctors in Boston, Benghazi, and Seattle.
It was very interesting when we first arrived at the Benghazi Medical Center. We saw what looked like a landscape that had been frozen in time.
Now, Libya is a country that has a big heritage, and it's a diverse country, and it's a very beautiful country that had been blighted by the rule of a tyrant. Now, part of the systematic destruction of the old regime was destroying the institutes of the country, and healthcare institute was destroyed systematically.
You know, we were asked to come and to see if we could help, particularly around establishing emergency care in the country.
In Benghazi and across Libya, the number one cause of death is road traffic accidents. And one very important reason why our people die is because we do not have proper emergency services, we do not have trained paramedics, we don't even have a call center. What we are here after is actually a collaboration between the Benghazi Medical Center and the Mass General Hospital, and perhaps to open the door and start collaboration with other hospitals in order for us to improve our healthcare services in Libya.
My colleagues at Seattle Children's Hospital wanted to do something to honor my brother in the way of an endowment or a medical project of some sort. So having talked to Thomas about what he was doing and having talked to my colleagues about their wishes to garner local support in a project, I introduced them to each other, and this kind of took off in a way that brought up the idea that maybe we could provide some education and training as well.
And in fact, you know, Chris Stevens described this is exactly the kind of activity that we need. Cross-cultural relationship building, supporting one another, learning from each other, and ultimately creating better health care for a population.
I know what he stood for during his life and what he really believed, and that was that the people in Libya were suffering very greatly and that they wanted to have a free country where they could be educated and live free. And I think he did his part to help them do that, and he wanted to continue that and wanted to help them develop collaborations.
The team that has come from the Benghazi Medical Center that we invited, first in Boston and now after the relationship we've established with Anne and her colleagues here at Children's Hospital, I think has become particularly poignant is that it's very real, the sense of reconciliation and the sense of hope, inspiration, and moving forward, seeing Anne in embrace with Layla.
The main need that we have right now is for us to get expert help and advice in order to organize and implement the new systems which do not exist, in Libya, and to train our cadre, our staff.
When I read about a violent event that's happening, about militias out of control, about poisonings occurring, and these terrible things that are happening in a country that has no or very little infrastructure and little ways to help the people, I feel frustrated for them. They're working as hard as they can to make it better, and it's going to be a slow road.
All of the acts of violence that have occurred against Libyans or foreigners in Benghazi have touched us dearly. What happened with Chris, for example, has affected us as much as it has affected, the American people, I suppose, because there is something that we have been through for 43 years, and this does not represent us, simply because we are all against, terrorism, we are all against violence.
This incident unfortunately slowed down our activity rather considerably in terms of the projects that we were going to create. However, it added now a third leg to a stool, and perhaps this stool ultimately will be a whole lot stronger than it could have been with just 2 legs. And now we're really looking at Mass General Hospital together with the Benghazi Medical Center, also welcoming Seattle Children's Hospital and Ann Stevens and her family and her amazing colleagues to join us in holding hands across this divide.